there is no right answer, unfortunately, and everyone is trying to figure out the best possible way. I think what everybody suggested pretty much covers everything that we know so far. But in addition, I think it's also very important to know what the community prevalence of the virus is. We are learning more and more that there are a lot of asymptomatic patients across the world who are positive and remain asymptomatic. And until and unless we know that denominator, we know what the actual prevalence of the virus in the community is, it's difficult to plan accordingly. For example, Germany right now is looking at a strategy in which they look at individuals with antibodies and then kind of certify that these individuals are fit to join the workforce. These individuals can go out and work again, while as those who don't have the antibodies continue to stay at home. There's also a strategy looking at only letting the 18 to 35 or the 18 to 50-year-olds step out, the ones who need to run the workforce and who are at an extremely low risk of death from the virus. So I think these are also strategies that can be thought of in terms of a staggered release of the lockdown. The other thing that's extremely important that we must realize is no matter how we do it, no matter when we do it, wearing masks is something that we need to absolutely enforce. Physical distancing is something that we absolutely need to enforce. And avoidance of any gatherings and any crowds are an absolute must. So no matter when we do this, these rules, I think, are going to need to stay for a long time to come.
I'm sorry, if I can just take you back to the point that you made and ask you to perhaps explain it a little bit more to our viewers right now. The one about the antibodies and the antibody test. Why is that essential and what will that show? Because I think that's also something that the COVID task force and Dr. Guleria in the day also mentioned. Just help us understand that better.
So what's happening right now is that all the individuals who are getting tested are either symptomatic. So they have symptoms or they're manifesting a severe form of the disease, or they have been in contact with somebody who has manifested those symptoms in the past. What we are finding, what the initial data from Italy, from early data from Maharashtra as well, suggests that a lot of these individuals who are being tested just because they are contacts are asymptomatic and remain without symptoms for a long time. So it is therefore possible that a lot of individuals in the community out there have been infected with the virus, have remained asymptomatic, and therefore not got tested. And if these numbers are high, then the actual prevalence of individuals who have a severe form of the disease, we would realize is actually low. What would happen as a consequence of this is those individuals who test positive for antibodies, who've had the virus, who've been infected, who've remained asymptomatic, who had no problems whatsoever, can kind of be assumed to have some sort of immunity against the virus and therefore are safer to come back into the workforce. Of course, we don't know yet the data about reinfections. We don't know whether there's a possibility that something might go wrong down the road. But based on what we know about most viral diseases, if you are infected, you have antibodies, you generally tend to have some sort of a protective effect, which would probably enable you to rejoin the workforce.